This 20-year-old woman was so frustrated that in spite of all the medications for her rheumatoid arthritis, she still had joint pain, fatigue, brain fog, digestive symptoms. She now had anxiety and depression and was wondering if she could ever get better. Well, I'm happy to say she did get better, and I will show you how I helped her do that. And if you find this information helpful, please like and subscribe so that more people can see this video. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And I've been blessed to have seen over 100,000 patient visits over the last 38 years, many of whom have gut and thyroid issues. And this 20-year-old patient came in who had been diagnosed with rheumatoid arthritis since she was 9 years old. She had joint pain in her shoulders, elbows, wrists, hips, knees, ankles. She had stomach pain, heartburn, indigestion, bloating, gas, nausea, fatigue, brain fog, anxiety, depression, weight gain, frequent vaginal yeast infections and UTIs, PMS, menstrual cramps, itchy skin, acne. The list goes on and on. She was given the usual medications for rheumatoid arthritis: methotrexate, prednisone, non-steroidal anti-inflammatories. Over the prior 2 years, she had been doing a weekly injection of this drug called a biologic, which affects the immune system. And she was concerned because of the potential side effects, increased incidence of cancer and other diseases. And not to mention, she wasn't feeling any better, so was really at her wit's end. The first step is getting the proper testing. Initial labs indicated she had low levels of blood sugar, cholesterol, thyroid hormones, and the functional testing I do for deficiencies, toxins, infections, food reactions, and hormonal imbalance indicated she had deficiencies of magnesium, B12, vitamin D, ferritin, low iron. Under infections, she had candida yeast and bacterial overgrowth of her intestines. Under food reactions, she had a gluten sensitivity with leaky gut. And hormonal imbalance, she had high levels of estrogen and DHEA, which is an androgenic hormone, can cause symptoms like menstrual cramps, acne, facial hair, excessive perspiration, all of which she had, and high cortisol levels. Step 1 is proper testing. Step 2 is an anti-inflammatory diet. And step 3 are supplements, which I will go over in a few minutes. The end result, though, was after a month she came in, she was feeling so much better. Her joint pain had cleared up. She had more energy. Her gut symptoms were better, less anxiety and depression, dropped 5 pounds, which she was happy with. And her acne and itchy skin had improved. In the one lab test I repeated, she had improvements in her low blood sugar, low cholesterol, low ferritin, B12, folic acid, magnesium, and she had decreases in uric acid and DHEA. When she came in after 2 months, she was continuing to feel better, especially her energy, skin, digestion, inflammation, and pain. And she stopped her medication 2 months earlier and said she was feeling great. When I saw her 2 years later, she said she had gone to a rheumatologist and she was cleared from her RA. Her doctor was very upset with her for stopping her weekly injections that cost almost $100,000 a year, and surprised her labs were normal and she had no symptoms from changing her diet and taking supplements. And that's what I'm going to go over with you now, which is the diet I had her on. I call it the FreeDiet. It's a diet I came up with years ago when I was figuring out how to heal my own autoimmune Hashimoto's thyroid condition and rheumatoid arthritis, fatigue, brain fog, IBS, skin issues. I was able to get better and since then help many others do the same. It's a diet that's not only free of gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. If you'd like a copy of the FreeDiet Phase 1 food chart, I'll put a link below for that, and a video at the end of this one that goes into more detail. And then in Phase 2 and 3, as you're getting better, you start adding additional foods back in. And step 3 are the proper supplements, and that included the functional 5, which is multi-fish-oil, vitamin D with K, magnesium, and a strong probiotic for her, along with other gut support supplements, including GI Men, gut immune repair, yeast defeat, microbalance, and others, and curcumin protect for a healthy inflammatory support, and other nutrients that she was low in. That includes iron, B12, vitamin C, zinc, and supplements for adrenal, thyroid, and hormone balance. So with that, she was able to get better. So if you're dealing with rheumatoid, autoimmune, or other chronic health condition, you basically have two choices there. So for instance, for her joint pain, she goes to the rheumatologist, gets medication for that. For her stomach pain, heartburn, indigestion, she would have to go to a GI doctor, get medication for that. Fatigue, brain fog, anxiety, depression, her primary or psychiatrist will write her prescriptions for all of those. Itchy skin, acne, facial hair, dermatologist, medications, weight gain, frequent yeast infections, UTIs, urologist, gynecologist, PMS, menstrual cramps, the same. So for each symptom, you go to a specific doctor and get a specific medication. So you can choose medicine. Unfortunately, it doesn't fix the issue. It can help you manage symptoms. On the positive side, you can eat or drink whatever you want, take your medication, and hopefully get some management of symptoms that way. Or you could choose health and get to the underlying root causes and be provided the right solutions with the proper diet and supplements. And I believe if you do that, almost anyone can get better. So thanks for joining me today. I'll put a video that goes into the free diet in more detail here and the free diet phase 1 food chart below. Feel free to like and subscribe, and I will see you next time.